Assalamu alaikum. So in this video, we'll be talking about the C8 and T1 nerve root examination. This is a series of videos that we are covering all the nerve root examination. Please go to the playlist on the channel. You can see the link above to watch those videos. We covered the C5, the C6, and the C7 nerve roots so far. And this video will be covering C8 and T1. I am Mohammed Draz, and this is your knowledge platform about the brain, spine, and beyond. So in this video, we'll cover the two nerves because their nerve supply is not huge. So I thought we'd cover those in one video. So we'll start here by the C8 nerve root, as you can see. So we will examine the motor examination, the reflexes, and the sensory examination. The motor examination for the C8 nerve root is quite limited, and that's mainly for the finger flexion. So the finger flexion is basically, you test that by mainly asking the patient for a hand grab. So you ask the patient to squeeze your finger and try to see if the patient can keep that and squeeze your finger properly, and you can't pull your finger out of their fist. So that's the easy one. Or you can basically ask them to flex the fingers and you oppose that action this way. So you try to oppose their action of flexing the finger. So that's kind of that interlocking way of doing it. So that's your hand, that's the patient hand, and you try to pull on while they're trying to do the finger flexion. And that's mainly supplied, as we said, by the C8 nerve root, and that's supplied by both nerves, median and ulnar nerve. In terms of the reflexes, as you can see, there are no reflex that can test the C8 nerve root. In terms of the sensory supply is, as I mentioned before, there is always an overlap, but the C8 is basically taking that side of the hand and also the medial side of the forearm. So if you want to test that, you can basically take that part towards the little finger and towards the medial aspect of the hand and the forearm. Again, that has to be specific. You try to pick a specific spot, so you standardize that for all of your patients, so you make it easier for yourself rather than jumping all over the place. And you can see that this is supplied from the front and the other picture is supplied from below. So now let's move to the T1 nerve root supply. So the T1 again is limited, similar to the C8. So the motor supply, as you can see, is mainly for the fingers. So always remember that T1 is for the fingers. So that's the fingers abduction and the finger adduction. So the finger abduction, so that's the outward movement. The abduction, that's the supplied by the ulnar nerve. And we have the finger adduction, where closing your fingers is the C8 plus the T1, and that's supplied by the ulnar nerve. How to test those? It's easy. In terms of the finger adduction, you're trying to close it. So you bring a paper and you put that paper in between the fingers one by one and ask the patient to maintain that piece of paper in between the fingers. So the patient is trying to keep their fingers closed together, and you try to put something and pull it out. In terms of the finger abduction, so they try to open it and you basically asking them to do that, and you try to push the fingers close together and close their hand, and that basically tests the finger abduction. In terms of the reflex, as you can see in this picture, there is no reflex to test for the T1. And in terms of sensory examination, again, it's continuation of what we mentioned before. It's kind of the upper part of the medial side of the forearm, and again also extending slightly towards the arm itself on the medial aspect. So again, if you want to pick a spot, it's probably the kind of the medial upper part of the forearm or the lower part of the medial side of the arm. There's an overlap definitely with the C8. So in this video, as you can see, we covered both C8 and T1 nerve root examination. Please like and subscribe to our channel, leave us a comment and let us know what kind of content you want to see on the channel, and if you find this content useful. And also subscribe and follow us on our different social platforms so that you can keep updated about those new videos. And we also share a lot of educational content on other platforms, on Twitter, LinkedIn and Facebook, and also to keep updated about our new courses coming up. Stay tuned for the next one.